and welcome to the second webinar in our series on MassHealth. Today's focus is the Adult Foster Care, AFC, and Personal Care Attendant, PCA programs. My name is Jackie Doherty, and I'm the Director of Education and Outreach for the Arc of Massachusetts. First, some housekeeping info. The webinar is being recorded and will be posted on the ARC's YouTube channel. We will email you the video link and the PowerPoint presentations. After the webinar, you'll have an opportunity to give us feedback. Please take a few minutes to let us know how we can make our presentations more useful and more relevant for you. We will leave time for discussion at the end, but during the presentation, please put questions in the chat. Today, we are fortunate to be joined by two presenters who were both MassHealth certified application counselors. Melanie McLaughlin, project manager with the Federation for Children with Special Needs, and Jessica Russo, director of AFC at the Berkshire County Arc. Welcome, Jessica and Melanie, and thank you both for joining us today. Jess, whenever you're ready, you can begin sharing your screen.
Hello, everybody.
I just want to, before you start, Jess, I want to just one last thing. I'd like to take a minute to thank our donors and organizational sponsors. I think you can see them all there on the screen. Their generous contributions would not make our work possible. Thank you, and take it away, Jess.
So as Jackie mentioned, I am Jessica Russo. I'm the Director of Adult Family Care here at Berkshire County Arc. And I'm going to give you kind of an overview of the AFC program requirements and a little bit of what it's about. So first we'll start with what is adult foster care. So it's a program that is offered through MassHealth that pays caregivers a non-taxable but countable daily stipend to provide care for individuals living in their home. The program also includes regular case management and nursing oversight from a team at the AFC program. At Berkshire County Arc, I just want to mention that I am the Director of Adult Family Care, not foster care, because typically we are serving loved ones who are taking care of loved ones. And it can be anyone from a young 18 or so developmentally disabled adult child who's being taken care of by their parents, or maybe it's a disabled adult child that's being taken care of by their siblings. We also have quite a few people on our program who are traditionally aged, who are aging and in the elderly population and need supports and services, and they are maybe taken care of by a child. So we do serve a gamut of individuals in our program at all ages, and I'll talk a little bit more about that as we continue. So in order to qualify for the AFC program, you have to be working with an accredited AFC provider. You have to have an approved home setting, and the AFC caregiver has to live in the same home with the member. And, you know, for an approved home setting, it just needs to be sure you're living in a residential area and that your home is clean and clear of any pests or safety concerns. There's a little bit more detail that you would go in, but really, as long as you're residing in a residential home that is traditional, there would not be any issues with eligibility. And then the member has to have direct care with ADLs, and this, which are activities of daily living, which I'll explain the qualifying ADLs in a minute. And they have to have supervision, cueing, or physical hands-on assistance in one of those activities of daily living in order to qualify for the program. The activities of daily living that are considered countable for eligibility for the AFC program include eating, bathing, dressing, transferring and positioning, toileting, walking, or moving around. I will say that in AFC, we do track personal hygiene, but it is not a qualifying activity of daily living. So in order to qualify, your loved one or the individual who is to be served would need assistance in one of these areas on this slide. Member eligibility. So in order to be eligible for the program, the member needs to have a MassHealth product type, either MassHealth Standard or MassHealth Common Health, and they have to be 16 years of age or older. The member needs a written physician's order in order to participate in the program. Like I said, they must require supervision and queuing for one activity of daily living, and they cannot be receiving any other type of similar service. So they cannot be in the PCA program, they cannot have a home health aide, they cannot have homemaker services. Those would be considered duplicative. And in our AFC program, we really strive to ensure that the individuals that we're caring for get the most appropriate services for that where they're at. So at some point, there might be a time where an individual needs to transition out of AFC, and we would help them get into whatever other program is going to be most beneficial. A lot of times, sometimes we transition from AFC to PCA, depending on status, that kind of thing. I did mention that the individual needs to be 16 years of age or older. When I get to the caregiver slide, you're going to see that the caregiver cannot be a guardian or spouse. However, we can intake somebody as young as 16 into the program if there's another adult living in the household that is capable of providing them care. This could be maybe like an adult sibling or a parent or a step parent, that kind of thing. For the caregiver, they have to complete an AFC caregiver application. This process varies based on the AFC provider. In terms of our AFC program, we have a simple application that needs to be filled out, a questionnaire regarding why they want to be a caregiver, and then we check 2 to 3 references. They also need to undergo a Corey, Sorry, and OIG check. And they have to complete the training requirements outlined in the AFC regulations. So the AFC regulations require 8 hours of ongoing caregiver training, and you also have to be first aid and CPR certified. Like I said, the caregiver cannot be the legal guardian or spouse. There is a bill that's been in legislature for quite some time to try and change that rule, because there are a lot of individuals who are being cared for by their legal guardian or spouse, and in some cases, we actually have someone in our AFC program who the parent is the caretaker and there is no other parent in the picture. So she has chosen to be her daughter's caregiver and has given guardianship to a court-appointed legal guardian. So sometimes that happens. Also, in some cases, if a disabled adult child is living with both parents, we'll see the one parent take the role as the caregiver and the other parent take the role as the guardian, if applicable. And these are just the roles of the AFC caregiver directly out of the AFC regulations. So you have an idea of what as a caregiver, it's expected from you in AFC. So you're supervising and assisting the member with their activities of daily living and instrumental activities of daily living. I didn't include a slide on instrumental activities of daily living because even though they are so important, they are not qualifying factors for the AFC program. But those activities include things like cooking meals, transportation, money management, shopping. So we do track those. And the caregiver is expected to participate in that for the member, but it is not a qualifying factor for the AFC program. Obviously, they're monitoring any non-emergent or emergency changes and making sure anything that needs to be reported to the AFC provider is done. They have to continue to maintain the qualified home setting for it to be appropriate. And again, I shared a little bit about what that means. It is also required that the member has their own bedroom with privacy and specific things included in that. But again, if you are looking at AFC, at least in our AFC program, I can't speak for all AFC programs, but we would help the family work towards ensuring the home setting is appropriate to move forward. They have to complete a caregiver log each day to reflect that the care that they've provided to the member. And again, that's something we would train the caregiver on, and it has to be sent to the team monthly and reviewed. So both the nurse and the case manager on the case review them, and they're kept in the member's file. They have to ensure that they are making sure their member is going to taking all of their medications as prescribed. The medications are being refilled. They're getting to their medical appointments. They're complying with health instructions from their medical providers, and they're scheduling medical care if needed. They always need to notify us if there's an emergency or a need for alternate care. And then they have to immediately notify us in some instances, which include, but are not limited to, medical emergency, fire, and departure of the home for whatever reason. So there are 2 levels in AFC. A member can be a level 1 participant or a level 2 participant. In order to be a level 1 participant, the member needs supervision and cueing and at least 1 activity of daily living. To be a level 2 participant, the member needs daily physical assistance with 3 activities of daily living, or daily physical assistance with 2 activities of daily living and a behavioral component. And then I just wanted to give a snapshot of what those qualifying behaviors might be, which include wandering, verbally abusive behaviors, physically abusive behaviors, socially inappropriate behaviors, and resisting care. And of course, this can also include behaviors such as self-harm. So there are a wide variety of behaviors that we track with our individuals, and we try to, again, provide care that's pretty person-centered. So like I said, when you provide care as a caregiver in an AFC program, you receive a non-taxable but countable stipend for the care that's provided. So this means you do not pay tax on this stipend, but it is countable and can be used as reportable income when looking to maybe finance a new home or get a car loan, something of that nature. The stipend amount varies based on location and AFC provider, but in 2024, MassHealth has implemented minimum stipend requirements. So for a level 1 participant, the minimum stipend is $25 a day. And for a level 2 participant, the minimum stipend is $49 per day. Typically, most AFC programs pay a little bit above that, but again, like I said, the stipend amount is going to vary based on location in the AFC you're working with. So then you're looking at potentially a minimum non-taxable stipend of $9,125 to $17,885, depending on the level of care required. So the prior authorization process, how it works in our AFC program, and again, I can't speak to them all because it's agency specific, but we have an intake team of a case manager and a registered nurse who go out to the house and assess the home setting. So the case manager does the home setting assessment piece, the psychosocial assessment, those things. And the AFC registered nurse or a licensed practical nurse under the supervision of an AFC nurse will go to the home setting to conduct an assessment of the potential AFC member, which has quite a bit of information in it and is actually shaped off of MDS, but these are something that I'm not going to get into. And if you were interested in AFC, we could discuss it further. So the nurse would make their assessment. If they feel like the member is a good candidate for AFC, they can complete what's called a primary care physician form that is sent to the member's PCP and reviewed and signed off on by the PCP. And once all of those documents are complete, the PCP signs off, we send it to MassHealth for prior authorization, which is good for a year. And then we have to continue the prior authorization process. It's important to note that the primary care provider has to be a MassHealth enrolled provider in order for the individual to receive services. Even though that we administer them, the primary care provider is the ordering physician, and MassHealth will not pay claims unless the PCP is enrolled with MassHealth. The role of the AFC nurse. So again, depending on level, the individual or the member in the program would have monthly AFC visits. For level 1s, the case manager and the AFC nurse alternate. So 1 month the AFC case manager goes out, 1 month the AFC nurse goes out. For level 2s, it's required that the AFC nurse and the AFC case manager visit. And again, the nurse is completing all assessments. They're helping caregivers with coordinating care, maybe providing some educational insight to the members' diagnoses. They review the caregiver logs, and as I mentioned, they conduct on-site visits based on level. And of course, the nurse and the case manager will be involved in any discharge planning or transitioning to a different setting depending on the member's needs. The case manager, again, they're going to be doing AFC visits. They're responsible for ensuring the home setting is up to date and safe. They're responsible for conducting a psychosocial assessment. And then they're also responsible for ensuring that there's an emergency evacuation plan in place and that families are completing 2 emergency evacuation drills per year. And then they also would be participating in discharge planning. If you're interested in looking to find an AFC provider in your area, you can go to the Mass Council for Adult Foster Care website and check their provider list. I will caveat this with not all AFC providers are part of the Mass AFC Council, but this was the one place where you could search to find an AFC provider. And then Jackie and I just we had done a PowerPoint on MassHealth 101, the basics and eligibility, but we wanted to share this resource with you, which is Healthcare for All, which is advocates who can help you in the state of Massachusetts with any types of insurance needs. And a lot of the times that they will kind of review new regulation and policy and make it easier to understand. So it is a great website if you have any questions regarding insurance. And then we also are continuing to include the Mass Health Ombudsman Program information, which can assist with any issues that arise based on the type of based on the Mass Health programs and services that an individual is receiving. And then this is my contact information. If you have any questions, feel free to reach out. I'm happy to answer any questions about AFC eligibility and try to connect you with an AFC program in your area if you feel like it's the right fit. And Jackie's information is there for if you have any questions for her. And I'll hand it off to Melanie and we'll take questions at the end of the program.
Thank
you,
you.
Jess.
Thanks, Jess. That was very informative, very helpful. Hi, everyone. I'm Melanie Perkins McLaughlin with the Federation for Children with Special Needs in Mass Family Voices, which is our health care project with the Federation. I'm just getting ready to share my PowerPoint, so bear with me. Can you folks see that? Yep, good. Let me just move the...
Yes, Melanie.
Hi. Hi,
Okay.
Arlene. How are you?
Phenomenally well. I just said good afternoon to you in the chat. You couldn't see.
Oh, I can't see it. You're right. Thank you. Good to see you.
Good to see you as well.
All right, so let's see from beginning, view slideshow. Okay, so welcome everyone. Like I said, I'm Melanie Perkins McLaughlin with the Federation for Children with Special Needs. We have we're a project-based nonprofit organization that was started by families 50 years ago that were advocating for their children to have the right to go to public school and to, have access to health care, and children and young adults to have access to health care and, be part of. So they were instrumental with the Arc of Mass and other organizations in creating family to family health information centers, which is what Mass Family Voices is under. And every state has a family to family health information center. So not only were these parents and other organizations in Massachusetts at the forefront of this advocacy, but they were smart enough to make sure that this was scaled at a national level, so that there's a parent information center, which is housed at the Federation, and that's specific to education, where you can call anytime and ask questions about special education and get resources. And we have intake lines for healthcare. And as I said, we're a project-based organization, so we have multiple projects that assist in a number of ways: family and community engagement, parent-to-parent mentoring, all sorts of things, caregiver, respite, all sorts of things. So please feel free to reach out to us and learn more. You can also learn more at our website, which is down at the bottom of the slide there. I want to thank Jackie and the Arc of Mass and others for partnering with us and giving us the opportunity to present to you all today. I am, as Jackie mentioned, a certified application counselor with MassHealth. We have 2 on staff. We're about to have 3. And what that means is you can book appointments with us and we can help with insurance needs and other needs related to MassHealth. We have a portal that we have access to that the general public does not have access to, where we can work directly with MassHealth in assisting with applications and disability supplements and all sorts of things. We partnered with Healthcare for All, which I was really glad to hear mentioned on their MassHealth redetermination project, which was a year-long project from a year ago. Well, it actually will be a year in April from when the public health emergency was discontinued, and really making sure that people knew about MassHealth redetermination and the fact that MassHealth renews information every year. That didn't happen during the public health emergency. So a lot of people were inadvertently dropped off the roster when it started happening again because their information wasn't updated, what have you. So it's very important to answer your mail from MassHealth, to keep documents from MassHealth. I create a 3-ring binder for my family, save all my documents. I even save the letters with the post stamp because it can be important. And I, take note of any deadlines or what have you, and also make sure that they have up-to-date information if anything changes. It's important to do that. So today we're going to talk about the personal care attendant program. And we have some links that Jackie will share with you. And this is a program that's offered through MassHealth that, helps individuals with disabilities maintain their independence and learn skills. And it provides funds to hire personal care attendants. And so what is a PCA? It's obviously somebody trained and hired by MassHealth to assist with the activities of daily living and the instrumental activities of daily living that you heard about earlier. They work with some third-party vendors that we'll talk about shortly in terms of the process for PCA. And a PCA just provides support with everyday life for the child, young adult, older adult, anybody with disabilities that qualify for the program. So again, ADLs, we talked about this earlier, but it's important to know because when you get evaluated, you're going to want to have your young adult or person or loved one or what have you be able to document and share, or their caregiver be able to document and share what sorts of tasks they need help with, because that is how the PCA program is evaluated. So activities of daily living include the things you see here. For those who might not see the screen or need to listen, I'll just share that it's washing, brushing teeth, toileting, and getting dressed, eating, moving about, that sort of thing. Instrumental activities of daily living. IADLs include household services like laundry, shopping, cleaning, meal prep, transportation, to medical providers and other specific needs. So those are the things you'll want to be thinking about when you're applying for PCA and what the needs are. And to qualify for PCA services, I'll let you look at the slide for a moment. I don't like to read the slides, but I'll let you look at it for a moment. Oops, I get a little echo. Let you look at it for a moment, and then I'll read the pertinent information again for those who need it for accessibility. Okay, so to qualify, you have to be a member of MassHealth. MassHealth has different types of membership, standard or common health. A lot of our families have common health as a secondary. You have to have a doctor's approval for PCA services, chronic or permanent disability that affects the ADLs or the IADLs, and a need for hands-on assistance with at least 2 of the 7 activities that we talked about to be able to qualify. And how do you get PCA services? There are, as I mentioned earlier, MassHealth has third-party vendors that they hire to work programs like the PCA program. And the third-party vendors are, in this case, called personal care management agencies, PCMs. You'll notice there's a lot of acronyms in the healthcare world, as there is in the special education world. I was pretty well versed in special education, and then I took this job in healthcare 2 years ago with the Federation, and I felt like I had to learn an entirely new language. So if you hear acronyms being used and you don't know what they are, please ask, because you're not alone. A lot of people feel that way. I try to say the acronym name before the acronym just so that people do know that. But again, feel free to ask if you notice that that happens and I didn't share it. So the Personal Care Management Agency will evaluate the needs of the individual applying for the PCA services. And they then share their evaluation with MassHealth, and then MassHealth decides whether A, the person qualifies, and B, for how much time for PCA services. You have to sign the evaluation after it's done, and review MassHealth will review and again decide to approve, modify, or deny the request based on the evaluation. But again, it's a nurse that comes out to your home from a third-party organization, so that nurse will contact you or the person with a disability and make an appointment to come out to the home. And this is the time when you want to be prepared for the evaluation to really be able to determine the personal care attendant hours. So, really thinking about how much time it takes to do the tasks that are needing to be done with the individual with a disability. And it might be a good time when you're applying to start, to think about or to start collecting data on what does that time look like? How long does it take? Because they're going to come out and ask those questions. They'll meet the individual with the disability. If it's not the individual with the disability applying themselves, they'll want to meet them, and really thinking about what that data is, and include your time for transfers into vehicles, any physical prompts and queuing, and the more details, the better. So again, it's a good opportunity. We keep a notebook in our kitchen, sort of that's just around our loved one, and we can just jot down in the notebook how long it takes for these sorts of things. And I think that a lot of families, having been through the IEP experience, or a lot of individuals qualifying for employment or what have you, might downplay or might be used to downplaying a little bit their needs. And, I want to share with you that this is not the time to do that. This is the time to really, be sure that you're sharing exactly what the needs are of the individual or of yourself, so that you can qualify for as much time for PCA services as possible. And so then once a year, the nurse will come out to your home again to evaluate your PCA hours, and you'll, get an appointment. And also, for folks who don't know this, it took me a couple of years to realize this, but also MassHealth in general, not just the PCA program, but MassHealth, whether it's standard or common health or what have you, they also review your eligibility each year. So you'll get a letter around the same time each year asking, something about your eligibility, and you need to respond to that. That was part of the redetermination program I was talking about with Healthcare for All. You need to respond to that eligibility letter once a year, annually, because if you don't, you might find that you or your loved one is dropped off of the MassHealth roster and might not understand why. And the reason typically is because there was no response to the eligibility letter. So much like the annual redetermination, there's an annual evaluation for PCA hours where the nurse will come out, again and evaluate. And this is also, again, a time to notice have the times that are required for the instrumental activities of daily living, or the ADLs, activities of daily living. Have they changed? Have they gone down? Have they increased? Do you have a new diagnosis? Make sure that if there is a new diagnosis or a secondary diagnosis, that you include that, with your documentation. Any letters, again, from doctors or from providers or from, anybody that you feel is, relevant, could be school support services, any of those that, you have for support about what your individual or loved one or yourself needs, is really good to have. Again, the more details, the more data, the better your chances are of getting hours and sustaining those hours or increasing them. If you find that your hours have been decreased, and I've been doing a lot of, as part of the Mass Family Voices Family to Family Health Information Center with the Federation, we attend a lot of advisory groups and we bring the family voice to the advisory groups. And that would be with other nonprofit organizations, other hospital, organizations and or representatives from MassHealth. It's sort of a team approach, and we are often sharing the family perspective and what's happening. What we have been seeing is that pretty regularly PCA hours are getting reduced. So you want to, take note of that. And if your hours are reduced and you feel like that's not justified, you can file for hearing. I had a very good mentor at one point tell me to file for hearing, whenever there is a reduction, if I feel that it's, or if the individual actually requires more or the same, that it's really important to appeal. I think some people can be intimidated by the appeal process because they might feel like, it's intimidating or what have you. But certified application counselors can help with that process. They can even, attend the meeting with you if you like, as can, any of your loved ones or what have you to be at the meeting. It can be a virtual meeting. It often is a virtual meeting. And you can testify as to why the time that was reduced, if that's what happened, is not justified. You might see that it gets really incremental with MassHealth. So they'll say, you might see, a decrease in hours for 10 minutes for, toileting, a decrease in hours for 3 minutes by, 3 minutes is an exaggeration, but say, 15 minutes by transporting and, transporting, into a vehicle, what have you. So you're going to really want to look at those specifics and say, and justify why you don't think those hours need to be reduced or why you believe those hours need to be increased. And so that's the hearing process. And then you'll get, there's an independent hearing officer, impartial hearing officer, and then there's a MassHealth representative, and then there's the person with a disability and or their representative. It can be intimidating sometimes because you have to take an oath that you're telling the truth, but that's okay. You're telling the truth. So, feel free to reach out anytime. We don't want folks to feel intimidated by this process. It's important to be able to get what you need. And how do you find a PCA? This can sometimes be the rub. It's like, okay, you got, approved for a PCA, but now it's like, oh, now how do we find one? And we know that there are workforce issues in our community. So it can be, it can be hard. And it is the, individual with the disability and or their representative that is hiring the PCA. So there'll be training from the payroll organization. So there's another third-party vendor that deals with payroll. In this case, it's called Tempest Unlimited. And they'll deal with payroll and they'll offer training for the PCA and or, other resources. And also for the individual, whether it's the person with the disability hiring the PCA or their representative. And so there are a number of ways that you can find PCAs. Their rate is, as stated here, $19.50 an hour. There's a PCA directory that is online and available through the state. And there's some others like care.com and idealist.org or even Indeed. You can post wherever, some folks post with their volunteer organizations in the community that are, experienced with disability or with retired educators or, at the local high school or, via social media or word of mouth. But, any way that you can is a good way to reach out and, and look for your PCAs. And then managing the PCA services. So again, MassHealth is the employer of the PCA, but the member is MassHealth sort of pays the PCA, but the member is technically the employer of the PCA. So that's the person who recruits, hires, trains, schedules, and oversees the PCA program. So that's either the individual with the disability who requires the PCA services or their representative. But it's important, even, if they have a representative, it's important to remind, the recipient and the PCA that, it is the individual with the disability who is the employer, and their needs are what need to be met, and that they manage the program. And again, if they can't manage it independently, then a surrogate can help. In this instance, a caregiver or guardian can act as a surrogate in managing PCA services if the individual is over 18. I'm getting a little background noise on somebody, I think that's unmuted. I don't know if Diane, you can mute. There you go. Thank you. So there's some flexibility with who can be your PCA. It cannot be it can be a friend, neighbor, family member, but can't be your spouse. And if it's a child, the PCA cannot be a parent, foster parent, or person legally responsible for the child. It can be siblings, it can be grandparents. We had a PCA program where our daughter was coming home for college, and she was able to help care for her sister and be employed by the PCA program. It was really great for her to get resume experience. It was great for her sister to be with her sister, and it was a good deal all the way around. So it was important to be able to have that and to know that family members can be PCAs. Personal care attendants have to be authorized to work in the United States and have a social security number, able to follow directions and supervision, and willing to receive training and supervision. Oh, let me see. So we talked a little bit earlier about a fiscal intermediary, again, another acronym, FI, or another term that folks need to know. And that's the third-party vendor that we talked about that is the person who handles all the money, or the organization that handles all the money. In this instance, it is Tempus Unlimited. We find that they've been very responsive whenever there are questions, either from the employer, meaning the individual with the disability or their surrogate, or the PCA. There are, some people are like, well, if I'm hiring PCAs, I want to know that they're, I want to be able to screen them. But if I'm an employer without those resources, how do I do that? So there are programs here that help for that. So criminal offender record information help for PCA, the Department of Public Health Registry, the Disabled Persons Protection Commission, and the Sex Offender Registry Board are all places that you can vet the PCA application. This is really great information for the PCA program. I do have to say the PCA handbook is really outdated. The information is still accurate, but we're working on trying to get MassHealth to change it and update it more. So don't be surprised when you see that it's a little bit dated, but the information is still accurate. I want to mention that the Federation for Children with Special Needs hosts our annual conference every year. This year it's March 8th, so it's coming up soon. It's a virtual conference and has, dozens
Yes,
of.
that is correct, Melanie. I will be there.
Oh, good, Arlene. I know you'll
We'll
be
be there.
there. I'll be there too, and we're looking forward to it, and we're looking forward to seeing other folks there. There's lots of great,
Yes, I know.
yeah, there's lots of great information there, and we have multilingual presentations and interpretation, and that's one of the real specialties I feel like of the Federation. They're sure to make, they work
Yes,
really
that
hard on
is correct.
language access.
Yes.
So that's our website. And if you have needs, you can fill out an intake form on the website. Let us know. If it's a healthcare need, it will get directed to either myself or somebody working in the healthcare project. If it's a special education need, it will get directed to that project. If it's a respite need, it will get directed to that project. So you can fill out, and if you have multiple needs, you can put those on the intake form and they get filled out. And we serve individuals ages 0 to 22, but of course we never turn anybody away. That if they're older than 22, we also serve them or get them the resources that we need. We provide a lot of great resources. So now I'm just going to open it up to questions, and thank you all for listening. You're right, Jackie. We have plenty of time for questions.
Right. Thank you so much, Melanie. And I do want to add on, I think the Federation does a great job in providing direct services to our families around IEP preparation, parent
Mhm.
leadership. I mean, I've had lots of firsthand experience with the Federation for Children with Special Needs. And I do appreciate your time today. We have a lot of questions, so I'm going to breeze through as many as I can. And I would also like to recognize that my colleague Diane Huggan is here. She is our education consultant with the Arc of Mass, and she will also be helping me to make sure that we get to all your questions. I'm going to go back and start in order, but one that came up a couple of times was the difference between AFC and PCA in a nutshell. What do you see are the biggest differences? I don't know if you want to just take a stab first and then Melanie add anything in about that.
Yeah, so like I said, in the AFC presentation, and I know while Melanie was giving her presentation, which was excellent with tons of information. I appreciate that because as an AFC provider, I'm like, what does PCA do and how do we differ? Because it wasn't very clear to me in the beginning. So in AFC, you do not need physical hands-on assistance to qualify. You need supervision and cueing in one activity of daily living. So we find that we're able to support many individuals who are higher functioning in AFC because they only need supervision and cueing. But the difference is like in AFC, our caregivers are screened by us and technically subcontractors, whereas in PCA, you are choosing your caregiver, you are the one managing the program. And those caregivers are paid hourly and it is taxable, whereas in AFC, you're receiving that non-taxable stipend. Also in AFC, it's a program where you are providing the individual 24-hour care, whether that be, you in conjunction with other adults, or if they're going to, let's say, a day hab during the day to help cover some of those hours. Whereas PCA, it's based on, the hours you receive per day. It's not that they're in the house 24 hours. So those are to me, the big differences. I don't know, Melanie, if there's anything you want to add.
Yeah, and I want to add thank you for your presentation because it was really good to hear yours as well because I don't do as much AFC. So I was like, oh, when Jackie said we have questions, I'm like, oh no, I hope I'm not answering the AFC questions because I'm not as familiar. I will be soon. My daughter's getting older. But I would say the other differences are that the AFC program, you have to be 16 and older. The PCA program, you do not. Right. Also, somebody was just asking in the chat, can the non-custodial parent be the PCA for the individual? And no, the parents cannot be the PCA for the individual, but I think in AFC, if there's a non-custodial parent, they can be the PCA.
Right.
So those are some of the differences.
The parent, if the parent is not a guardian, they can be a PCA.
Really, Diane? Because I would, okay, we can double check that because I was told if they were parent at all, they could not be. Any other family member can, but not parent. But you're being told if they're non-custodial, they can be.
I can
Well,
clarify
I
that.
am, my son, I'm on his payroll. I got on his payroll several years ago when we just faced a really hard time and didn't have enough support. So yeah,
Yeah,
definitely.
and this is really important in terms of the legislative advocacy, Jackie. I mean, Jessica, I would love for you to jump in 1 second too, but I also just wanted to say in terms of the legislative advocacy, because of all the caregivers out there that are listening right now, we know how hard this work is, right? And the fact that, we're supplementing, an employee service, when employees aren't available, yet we can't get paid as parents is, not really justified. If you're doing the work, it seems like you should be able to get paid as a caregiver and as a PCA. So that is something if you're interested in finding out more about the Arc of Mass, as you know, does a lot of work around policy issues and their government affairs folks and Jackie can direct you to folks that, can help advocate for legislation around getting caregivers paid as PCA because it's an important issue. Jessica?
Diane, is your son an adult?
Yes, he
So
is. Yeah.
So that's the thing. When somebody is under the age of 18, their custodial parents are both considered legal guardians. Once somebody turns 18, like I've said, in a lot of cases for our program, we see one one parent become the caregiver and one parent become the legal guardian. But I have personally transitioned individuals who are their own guardians to the PCA program with the parent as their provider. Again, they're over the age of 18. So that's the difference. When they're under the age of 18, both parents are considered legal guardians. Once you're over the age of 18, obviously there are several different conversations about supported decision making and guardianship and those things. But a lot of the times we'll see one parent take the lead on caregiving, one parent take the lead on guardianship. But there are those parents who want, co-guardianship, and that becomes more difficult. But I understand that the reasoning behind that as well. Does that
Right,
answer
thank
your
you.
question?
That's,
All right, so we'll go to the next question. With AFC and PCA services, do you support multiple individuals in one home?
Mhm.
yes.
In
If,
AFC, oh, go ahead, Melanie.
no, I was just going to say, if they qualify, they certainly do.
In AFC, you cannot have more than 3 level 1 participants in one home or 2 level 2 participants in one home. So yes, there can be more than one participant, but there are limits.
And I think Sarah's question was answered, but I want to just throw it out there quickly. She was told that member now needs hands-on assistance with ADLs, not just supervision and queuing. Is that correct?
So that's that clear distinction between
Distinction,
PCA
right.
and AFC. PCA, you do need physical hands-on assistance. AFC, you only need supervision and queuing in one activity of daily living.
And I want to jump in and add, and that's why you really want to think about, the PCA versus the AFC post 18, right? Because you could still qualify for PCA or AFC, but you really want to weigh out which program is going to be most appropriate for your family member. Are you getting more with this program versus this program, and sort of again weighing it out. And as Jessica was saying, there's the opportunity there for a parent or otherwise caregiver to be able to do the work, especially if you're not able to hire a PCA because they can be difficult to find, and get paid for it through options where, again, one person might become the guardian and the other might be the caregiver. I mean, the PCA, I mean, the AFC. Sorry, so many acronyms.
I know.
But it can get confusing, but that's why we're here to help and clarify what can be best.
Well, I think that an example of that was during the pandemic, right? You had people that qualified for hours and hours of PCA services, but they could not hire PCAs. So that's where AFC becomes a better option. But as Jessica mentioned with AFC, you can't duplicate, you can't get both. So if you get AFC, you're going to lose the PCA hours, and you just, depending on what tier you're at, you're going to get this one amount annually. So it might not be worth it, depending on a lot of other factors. So here's a question from Denise. Long-term goals for my son would be to live in supported living. Can you please help me better understand why AFC would not follow him to supported housing outside of the family home?
It could. So AFC could follow him if he moved. So it all depends again on the best fit program. Like with PCA, you're paying someone to provide care. With AFC, the caregiver is a subcontractor, and you have that nursing and case management oversight, which that support can also mean a lot to families. So it's weighing those options. And I was transparent with the stipend amounts in AFC. So yes, it is non-taxable, but then it's a big ask to ask someone to live with your loved one for 24 hours a day and only receive a stipend of $700-ish to $1,500 per month for the care that they provide. So, but there are AFC providers. We do have one, a couple of true foster situations where they live with a caregiver and they provide care. So the things, it has to meet the basic requirements. The home has to meet MassHealth standards and AFC. and there does need to be a caregiver living with the member. A lot of times when somebody's ready to transition out of living in the family situation or the AFC program, we may see them go to PCA because they might get a little bit more money. We may also see them go to DDS's shared living, but in order to be eligible for shared living, you need to be DDS eligible. So AFC can travel with the individual, just oftentimes the family feels it's most appropriate for a different program to be providing the care.
Thank you.
That
And I
makes
know
sense?
you mentioned that it's not taxable. Could you just explain again for everybody the countable part?
It's countable, so you can use it as countable income, but it's not taxable. So you're not paying taxes on it. And in some cases, it may not be reportable. So that's a big thing too, if you're receiving benefits and you don't want to lose those. But I'm not 100% well versed in where it is reportable and where it isn't, but that's just another thing to think about. Whereas PCA money, you're a paid employee, you have to report that income for your own benefits. So if you're also on benefits, the AFC stipend may not necessarily be countable in certain places, but I'm not 100% well versed in that to speak on it, so I don't want to give you wrong information.
Again, and also in the PCA program, you have a payroll service, so you're getting the taxes deducted automatically. You're not getting a 1099, for example, where you have to do this. It's happening, and you'll have a W-2 and all those things, just like a regular payroll.
And we also had a question from Laurie. I think this is related to you, Jess. Why would the location impact the stipend amount?
That's a good question. Berkshire County is very different where I'm from the Boston area. And rates to pay nurses, case managers all differ. So the AFC program has to be able to meet both the caregivers' payroll needs and their team's payroll needs. So it differs. I don't think differs that much. It's not always published, but it's usually only a couple of dollars, but it may be because one agency might have a higher staffing cost than another agency.
Great. And then some good news here about the PCA pay rate, that effective April 2025, that the rate will increase based on the PCA seniority. I don't know if you had heard anything about that. And then Caroline mentions that the PCA union is organizing a rally on March 12th. We were not sure about that date, related to PCA pay, presumably in light of the many changes taking place at the federal level. Do either of you know anything about the potential changes in pay for the PCA program in the coming months, or anything about the rally?
I don't, but we have our PCA coming this afternoon, and I'm sure they get it on their Tempest Unlimited flyer as part of the union members. So I can certainly find out about that. I'm gonna also, just while we're on and talking, I'm gonna just quickly see if I can find anything on Google just about that. But
Well,
I
wait,
think
before you start Googling, I have a follow-up question for you. So I want to keep your attention on.
okay.
In
What's
what circumstances can a family member be a PCA?
if they are not the guardian, I'm the legal guardian or the parent for individuals under 18. For over 18, I guess that's a question from the 18 to 26 phase if they're receiving PCA as opposed to AFC. I still believe it's the situation that it cannot be the parents. But Jessica, do you know?
It can't be the parent or the spouse.
That's what I thought. Or the
It
spouse,
can be a
right?
parent if they no
If
longer
they're
have
over
guardianship.
18,
So if
right?
Yeah,
they're
if they're
over
over 18 and
18,
then they're not under guardianship.
then it can be a parent.
That's
It
right.
cannot
Right.
be a spouse.
But it's dependent on the 18 and over.
And how old does a family member have to be a PCA or an AFC provider?
Adult, so 18.
Well, for
18 for
PCA,
AFC.
yeah, for PCA, you can be as soon as you can get, it's like you can be, I think, what is it when you get an employment
16.
thing, 14 to 16, actually. I think you can get one at 14 in the high school. You can get in a part-time employment what do they call it? Workers. You can talk to your guidance counselor at the high school, but if you have a 14-year-old, a work permit, that's what I'm looking for, sorry. If you have a 14 to, 15-year-old, and they can get a work permit with their guidance counselor to the high school, you can even start as early as 14. I mean, I think that that would be with supervision, but that is my perspective on it.
How can they help with respite?
How can who help with respite?
Well, it's a they, so I'm thinking PCA, AFC.
Well, the PCA, there does have to be under 18. There does have to be a caregiver in supervising the PCA. So there could be, it's not meant for respite. It's meant for IADLs and ADLs. The Federation does have a caregiver to caregiver program. That's a respite program that you can certainly reach out to. Again, with the intake form, we know respite is desperately needed, but I'll defer to Jessica on the AFC.
Same thing. So in AFC, if you're being paid as the caregiver, you're responsible for coordinating care. There is a alternate caregiver stipend that's given for up to 2 days or two weeks, 14 calendar days a year. But again, it's at that stipend rate. So oftentimes, we see in our families where they will have the primary caregiver, and then they might have an alternate caregiver, which may be a sibling or somebody outside of the family. And again, we can help coordinate, find an alternate care provider. If we have alternate care providers available, that is something that, we could assist with. But it really depends on the situation and circumstance. However, if the individual is in DDS services and they have AFC, there are rules and regulations around respite. And that is something that if you're interested in AFC, definitely, look at AFC, but also make sure you're talking with your DDS service coordinator to ensure if you're getting like stipends for respite or things like that, if that would be affected, because that you definitely wouldn't want to happen. So how things are funded if someone is in AFC can be a little bit different when it comes to DDS, and you want to make sure that you have all of your information before making a decision about whether or not it's the appropriate program.
So I'm very cognizant of the time. Couple of really quick. Can you use PCA hours for babysitting? I'm thinking that's a no, right?
Yes, that's correct. That's a no. It has to be related to IADLs and ADLs. It's not for childcare. There was a good question earlier that I did just want to flag, Jackie, because I don't think that we did answer it yet. And the question was around the PCA provider not being your spouse or the AFC. Can you clarify what this is meant? Did you mean if the MassHealth member is eligible for PCA's spouse or the person that is their guardian spouse? So yeah, it's Jessica, you want to address that?
Yeah, so it's the member. So it's their relationship to the member. So it cannot be the member's spouse. It cannot be the member's parent. It cannot, if they're under 18, and it cannot be the member's guardian.
Good catch. What about, can a parent who is receiving PCA services be an AFC provider? I have physical disabilities, but I'm doing extensive prompting with my adult child. So somebody who's getting PCA services, can they also be an AFC provider for queuing and things like that for their son or their adult child?
I'm not sure about. I would have to read the AFC caregiver requirements and the regulations. So we can certainly look at that, but I think you're really going to have to, that's a question you would want to work with whichever AFC you're interested in joining directly. There are rules and regulations around the caregiver and their requirements. So I'm not 100% sure if that would work, but if you were to share your situation with an AFC provider in your area, and they might be able to support you or give you some ideas.
What about if there's only one parent regarding guardianship?
So we have an individual in that situation. The guardianship she has a court-appointed guardian and the mother is providing care. Actually, when that legislation was presented at the State House regarding that. We actually went to the AFC State House Awareness Day. And there was a story of how being the legal guardian can really and not being able to be the caregiver can really affect the health and well-being of an individual. So, but yes, you have to decide. So it's the parent's choice to decide how to be, whether or not they're the caregiver or the guardian. In some cases, the guardians work really closely with the caregivers, which is how it can work out, because they know that the parent is the caregiver there 24/7, and they are trusting the information that they're getting from them, and there is still choice, but